Hey guys, thanks for popping in and joining us today. Putting a video together to talk more about allergies, right? So extreme allergic reaction, this is also otherwise known as anaphylaxis. And typically individuals who have severe allergies will likely be carrying or have a prescription medication called epinephrine or an epinephrine auto-injector. So some early signs to see if somebody is having a severe allergic reaction is inflammation or swelling of the face, lips, tongue, mouth area, maybe jawline, swollen. We could have trouble breathing, so breathing emergency. We can have shortness of breath. So there's a few things that can clearly indicate, as well as rash, redness, hives, things along those lines. So when we have allergic reactions where an individual is having a trouble breathing emergency, this is now where we want to administer an epinephrine auto-injector, right? So anaphylaxis is our condition. Epinephrine is our prescription medication. This is an injectable medication we administer in the muscly part of the thigh, somewhere between the knee and the hip on the side where your pant line would be. This is a needle, which can now be classified technically as a bloodborne pathogen, so we want to ensure that we're being very cautious handling anything that deals with blood. So essentially what we do is we hold that auto-injector up to the injection site, which again is the side of the thigh, somewhere across the pant line where we're in the middle of the knee and the hip. Once we inject, we release the injection and we rub the medication into the muscle. And we're gonna administer this 5 to 10 minutes later, again, if they do have a second dose and the first dose did not help the situation and maybe it's getting worse or progressing worse, we would have to administer a second if a second one's available. In any case, we do want to make sure we're calling 911 when we have to do that because this is a breathing emergency. So one of the reasons we call 911 is, of course, for breathing problems, right? So again, inflammation, swelling, hives, redness, trouble breathing, these are things that can persist, and we do want to make sure that we're administering that medication quickly, or at least offering the person their epinephrine auto-injector so they can administer themselves. Always be wary state to state. We want to make sure we're checking to see if we can administer medications. Usually if you're not a certified individual, that could kind of get squirrely depending on where you're at in the country. So we do recognize and understand that, yes, there's a moral obligation. There's also a legal obligation, right? So make sure you check your state laws on administering medications like that, and obviously obtaining consent and things along those lines as well. So hopefully you guys enjoyed the video today and learning a little bit more about anaphylaxis and epinephrine auto-injector. Thanks.